Start. Okay. Hi, it's Stephanie again, and I'm here with Dr. Chris DeMartini from California Neurohealth. Our last series, we had gone and talked to Elham, the acupuncturist and um, licensed acupuncturist at their facility. And I'm here today with Chris. And so today we're going to continue talking about multiple sclerosis and see if he's got some other treatments that can be coordinated with Elham to make a really good treatment all of conversation. We had talked a little bit about how the use of acupuncture can open up different channels of energy that go through and get the system working completely with the neurological components like the spinal cord and the brain. Um, and so what I'd like to bring into the fact is I also want to tell the people watching is that I've gone to Chris many times and just said, okay, can you make my brain reconnect because it's got spaces where there's scars? So I'm just going to ask you, when someone comes in, what do you see when you have patients come in with MS? What do you see their struggles with, or they come to you? What concerns do they come with to you?
They come in with a myriad of different complaints. So anything and anything, everything under the sun in terms of MS complaints, whether it be visual problems, issues with dizziness or balance, pain, spasticity, even, problems with urination or sexual function, um, exercise intolerance, fatigue,
Heat.
yeah, heat intolerance, all those things. So, and the longer they have it, the more symptomatology they acquire. So,
Yeah.
uh, I would say as a chiropractor, board certified chiropractic neurologist, I would say the majority of people are coming in with some sort of pain or spasticity because their mind is not really open to the idea of what my specialty is. They don't really know. I
Well,
think chiropractor aches and pains, but realistically, what the specialty is yes, it's a deeper understanding of how chiropractic techniques can be useful in people with neurological disorders. But our scope of practice includes rehabilitation. So, majority of what I'm doing with people with MS is evidence-based rehabilitation from the neuro side of things, and
well,
that can include exercise. It can include uh, any type of therapy. Really.
yes. I know that when we've worked together in the past, I personally, with my MS, I have spasticity. I definitely have dizziness. I have all sorts of things that just make me not feel like I'm put together. And sometimes even just, it's not chemo brain, but it's like MS brain.
Yeah,
And
brain
so that's the issue. And I know when I came in, we've gone through a series of different just basic body adjustments. And then, so what would your, I guess, what kind of things would you do when, if I walk in the door, you never saw me again? Tell me how that would look if someone just came in and they've already done the upload and they've told you what their symptoms are, all that, and you start your treatment. Where would you be your first line of attack? What would you do?
I mean, after doing a comprehensive assessment,
Mhm.
I mean, it's dependent on the individual. So some people don't come in with any musculoskeletal complaints or, something that would really be amenable specifically to chiropractic manipulation or manual therapy. It just depends. People come
Well,
in and
let's say dizziness. That's a very common instability. How about that one?
so vestibular therapy, therapy that is focused on improving the function of the vestibular apparatus or vestibular associated um, neuroanatomy. So
I
exercises that help
I,
improve.
I don't know what that is. So
Oh,
what?
sorry. So exercises that help improve balance, and
Okay.
that can involve exercises that improve eye function
Okay.
or coordination of the limbs or the trunk.
Okay.
Uh,
That's better. I understand now.
yeah, yeah. So I mean, balance is a consequence of the integration or your brain's ability to take information from joints and muscles and from your inner ear and from your visual system and mix that all together to make balance and stability and awareness of where you are in space. And MS, given the nature of the disease, can affect any or all of those functionality, and the exam is really has to be very specific to understand where someone's deficits are. And there's no cookie cutter approach with MS. It's if you drop an egg on the ground, how can you predict how it's going to splatter? You can't. So
That's really
bring
true.
it and multiple sclerosis, especially the longer people have it, and it starts to get more um, muddy in the sense you have immune attacks from the autoimmune process, and then you have the secondary progressive stuff with degeneration, and then
Right.
other health issues. So we really have to look at the big picture of how we can promote better health for someone to help slow down or stop the progression of the disease.
I was gonna say, I know that a lot of people who have MS have multiple autoimmune issues that
Yeah,
kind of go together because it's all one big sister, assortment of things. So yeah, we don't always come in with just MS issues.
no.
So you do your adjustments according specifically to their needs, is what I'm hearing, correct?
I
And
mean, yeah, I can adjust them. I give them targeted exercises,
okay,
lifestyle recommendations, all that.
the targeted exercises is the really interesting thing I found that you did that was profound, and it was a long time ago. So I won't have it right, but I knew at one point if I was to start to turn around, I'd automatically get dizzy just because the room is moving, and
Mhm.
then but my brain isn't moving. My eyes weren't following. There were some tracking issues. It was hard for me to read at that point in my life, even as well. And so you had me do a very simple thing like spinning around in a quarter. So, kind of, what are a couple exercises that someone takes home to help with, say, dizziness or the I want to turn around and fall over? What what were some of those things that I can't remember exactly what, but I know you have things that help find neural pathways. Is there anything like an exercise you can explain?
Uh, I mean, as far as giving you like generalized exercise that anybody could do that would help them, I mean,
Yeah,
I think the most general helpful information is to understand that something can be done if you're having issues with balance and stability and dizziness. It's not something you have to live with.
that
Quite
very
often, it's medically treated with vestibular suppressant medication that helps antagonize some of the functionality of the nervous system to make the eyes less move less aggressively.
mhm,
But um, there's a hierarchy of the things we do in rehabilitation. We have to get somebody to be able to stare at an object and have their eyes be still. Before I can give them any exercises where they're spinning around, they have to be
yeah,
able to keep their eyes still on an object that isn't moving when their body's not moving. Some people have difficulty with that. So you can imagine if you can't even stare at something with your eyes still, how is it going to be when you spin around and move? So
um,
first thing first is keep people.
now, I know in previous conversations with Elham, she had talked about things like cold laser and things like that. Is it just adjustments and exercises when the therapy, or do you use other things besides that help people that maybe are more severe? I mean, kind of wondering.
I mean, the photobiomodulation or low level laser therapy or cold laser, we can use that over the skull in people if it's purely with a neurological deficit.
Mhm,
Uh, the light, certain wavelengths of light activate or influence the energy production of cells, and there's evidence that shows we can get it through the skull and affect the nervous system tissue underneath. We might do that as an adjunctive thing when we're trying to do rehabilitation, just to enhance the function of that area of the nervous system